It's Thursday, November 21st, and this is the Daily Medical News, where we bring you clinical medicine's top headlines as well as an in-depth look at the day's biggest story. I'm Molly Collegio.
And I'm Nick Andrews. Today, inpatient care continues its steady decline among family physicians.
Ubrogepant may relieve migraine pain within 2 hours of onset.
Why not all lung cancer patients are receiving treatment.
And the younger generation may be heeding the prevention message in the war against melanoma.
Plus, new research is bringing new hope in the battle to prevent and to treat hepatitis B virus infection. But first, we'd like to thank all of you who have helped us make this podcast better by taking our short listener survey. If you haven't done so already, please take a moment to complete the survey following the link in the show notes. And now, the top stories in clinical medicine.
Looking for a family physician? Don't look in the hospital. The proportion of family physicians providing inpatient care has dropped 26% over a recent 5-year period. And by 2017, just a quarter of FPs were practicing hospital medicine. That's according to a report published in the Journal of the American Board of Family Medicine. This is the latest piece of evidence that the scope of practice among FPs is contracting, the investigators reported. They pointed to other areas where FPs are playing less of a role, like prenatal care, home visits, nursing home care, and obstetric care. Most of the contraction, they said, is occurring among new FPs who can't find positions that allow them to use all of their skills. So what are they doing instead? Many FPs now work in large multi-specialty practices or hospital systems where inpatient care is handled by subspecialists or hospitalists, according to the report.
An investigational migraine medication appears to relieve pain and other related symptoms like photophobia, phonophobia, or nausea within just 2 hours. Ubrogepant is an investigational oral calcitonin gene-related peptide receptor agonist. In a phase 3 trial of adults with migraine, the acute treatment led to significantly greater rates of freedom from pain at 2 hours with both the 50 milligram and the 25 milligram doses compared with placebo. Patients reported absence of their most bothersome migraine-associated symptom at 2 hours with the 50 milligram dose only. The FDA is currently reviewing Ubrogepant for approval, and a decision is expected sometime in December. Dr. Richard Lipton is the director of the Montefiore Headache Center at Albert Einstein College of Medicine in New York and one of the study investigators. He said further research is needed to assess the effectiveness of Ubrogepant against other acute migraine treatments. Future studies will also need to evaluate the long-term safety of the drug among unselected patient populations. These data appear in JAMA.
About 15% of patients with lung cancer in the United States do not receive treatment. That's according to the 2019 State of Lung Cancer report from the American Lung Association. The reasons for lack of treatment vary, from a tumor having spread too far to a patient's poor health to treatment refusal, according to the American Lung Association. The rates of non-treatment across the United States are also quite varied. Arizona had the highest rate of non-treatment at just over 30%, followed by the neighboring states of New Mexico and California, both at about 24%. The country's lowest rate of non-treatment was 8% in North Dakota. The American Lung Association called for reducing the number of untreated patients by dismantling the barriers to treatment, whether it's a lack of knowledge, stigma associated with lung cancer, or the high cost of treatment. We'll be back after this message with more medical news.
Welcome back to the Daily Medical News. I am Nick Andrews. Sun protective behaviors may be having a significant impact on melanoma rates in the nation's younger generation. That's according to a study that looked at trends in melanoma incidence in the U.S. Researchers at the Fred Hutchinson Cancer Research Center and the University of Washington, both of which are in Seattle, analyzed data from a national database for the years 2001 through 2015. They found that the incidence of invasive melanoma among people of all ages increased about 50,000 cases in 2001 to about 83,000 in 2015. But a deeper dive reveals some promising trends among younger people. Between 2006 and 2015, the annual percentage change in melanoma incidence fell by 4.4% for adolescent males and by 5.4% for adolescent females. The incidence dropped by almost 4% among young adult males and among young adult females. Statistically significant changes for each age group. In contrast, the incidence of melanoma increased annually by nearly 2% for men and for women aged 40 years old or older. The investigators say that increased UV exposure protection was a likely explanation for the reduced incidence of melanoma in adolescents and in young adults, and they add that the data support continuing strategies to promote UV protection throughout life. These results were published in JAMA Dermatology.
There's growing excitement about novel treatments to attack hepatitis B. The new research was unveiled at the annual meeting of the American Association for the Study of Liver Diseases in Boston. During the meeting's last day, Dr. Mark Gainey of the National Institutes of Health summed up the most promising reports. In terms of novel treatments, there are 3 promising drugs currently in clinical trials. One investigational treatment is a novel class N-capsid assembly modulator known as JNJ0440. In a Phase 1A trial, the treatment appeared safe and well tolerated and resulted in potent inhibition of viral replication. Dr. Gainey said he awaits further studies on its effects on functional cure. Another investigational treatment is a liver-targeted antisense oligonucleotide. It's known as GSK404 and was tested in a Phase 2 placebo-controlled study of patients with chronic hepatitis B who are already on therapy. The novel treatment has acceptable safety and produced dose-dependent declines in hepatitis B surface antigen. Dr. Gainey called this a proof of principle on the use of antisense oligonucleotides to reduce hepatitis B surface antigen levels. The third novel medication is the toll-like receptor 8 agonist GS9688. In a Phase 2 randomized placebo-controlled study in virally suppressed adults with chronic hepatitis B, it was safe and well tolerated. It also results in dose-dependent pharmacodynamic changes. In the study, 5% of patients experienced significant decline in hepatitis B surface antigen levels by week 24. Dr. Gainey said this was a promising approach that merits further investigation. And that's it for today's Daily Medical News. Be sure to check out the newest episodes of the Dermatology Weekly and Blood and Cancer podcasts, available today and every Thursday. For MD Edge, I'm Molly Collegio.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News. We'll be back with the top stories in clinical medicine tomorrow.